Hello, everyone, and welcome. My name is Maria Kliavkoff, and today we're going to talk about the depression of grief. This is a question that was brought forward to us by Allison. So, Allison, I'm hoping you're going to be able to join us, and if not live, that you'll be able to see this in replay. For anybody who is joining us live, I welcome you to write notes in the comment section so that I know you're here and you're with us, but also in case you have any questions about this. So what I wanted to talk about today was the feeling of being depressed, right? That feeling of heaviness and weight on your body, in your being. Allison talked about feeling like she can't leave the house. So depression is a very natural part of the grief process. It's actually there to slow us down. And we want to be listening to those cues, those internal cues. So if you are feeling sad and depressed and you're feeling like you don't want to leave the house, please know that's a normal part of the grief process. And many wisdom traditions include times for the person who is grieving to really take the time and sit still and be in the house. Certainly in the Jewish tradition, there is sitting Shiva, which for 7 days is sitting in the home and having people come to you. I remember after my mother died, there was a lot of busyness to do, so I wasn't able to just stay in the house as much as I really wanted to. And it wasn't until I came back home that I realized I needed time to just sit with and be with my pain. And I needed to take a week to just be still. So if you haven't done that, if you haven't taken the time and your body is calling for that, then I strongly invite you and encourage you to take that time to be still with it. If depression is being persistent, in other words, if you're feeling like I don't want to get out of bed, I don't want to get out of the house, and you check into your internal being around this, and your internal being is saying, this is not true for me anymore. There was a time when this was true for me to do, but it's not true anymore. That's when depression gets into a stuck place. So please hear me very clearly. If you are feeling depressed, and particularly if you're in the early stages of grief, allow yourself to feel that. Allow whatever is coming up for you, because that is such an important piece of the puzzle, to be willing to be with your depression. If in the past you have experienced clinical depression, there is a difference between the depression of grief and clinical depression. Dr. Alan Wolfelt wrote a brilliant book called The Depression of Grief that actually outlines the distinction between the two, and I encourage you to look that up and to learn more about it. It's been my experience with clients that when clients have had a history of clinical depression, then those people are the ones who are watching the closest, because you know the slippery slope of clinical depression. You know what that feels like in your body. You know when you're starting to slide into it, and you know to get help. And I encourage you, by all means, if that is the truth for you, to get help, to get some outside eyes on it. For the rest of us, if we find that that depression is lingering and that we're really just not wanting to go out, it may be more than depression. It may be more about what going out means to us, and how we need to be thinking about that. If you're having a deeper experience of depression and you're needing to find your way out of that, and you're needing to find your way out of being stuck in your grief, then I invite you to give me a call and let's set up a time to talk. Because what we want to make sure of is that you are honoring your grief as it comes up, and that you are moving through it with ease and grace. Being present to the depression as it's showing up, being willing to be in that sadness, being willing to be in that space of, right now I can't go out, and so let me sit with this and let me learn what it has to teach me. That's going through it with ease and grace. It's pushing against the depression. It's pushing through it and fighting to be out there and do what you need to do. And the depletion of that and the exhaustion of that you feel in your body. I remember pushing through that, particularly after my father died. I remember pushing hard through that and feeling just so physically exhausted. I felt like I couldn't keep my eyes open throughout the course of the day. I felt this heaviness and this sadness, and instead of allowing myself to feel that sadness, I just kept pushing up against it. And I was really afraid of where that would lead. I felt like it was a rabbit hole. I felt like if I let myself step into that depression, if I let myself feel the feelings of that I'd be going down a rabbit hole that I'd never get out of. And I was terrified of that. And so I fought really hard not to let myself go down that rabbit hole. If you are experiencing that and you are needing some more assistance in this, please give me a call. It's something that we can't handle in the confines of this group. It's a much bigger conversation. And we want to make sure that we're honoring your grief journey and that you are getting the support that you need in that grief journey. So again, private message me or put a message in the comment section here and I'll follow up and I'll private message you and we can have that conversation one-on-one. In the meantime, I wish you much peace and blessings. I'm just taking a look here to see if there are any comments coming through, but I'm not seeing any. So with that, we'll just leave it at this for right now. And I look forward to the next time that we connect in Facebook Live. Peace and many blessings to you today and throughout your grief journey. Namaste.